Guys, today is what? January 23rd. It's on a Thursday. We're gonna go over how the vaccines work. What are some of the things we should consider regarding, viral infection and bacterial infection when it comes to treatments, and then also just respiratory infections in general. Like, what's the difference between like a viral infection? How do we know we have viral infections? All that. And I'll just quickly go over how the COVID vaccine differs from like the regular vaccine. Um, so that way we have a little knowledge. I know some of us are nurses, like Denise over here. She's working on to become like a doctor or something like that, right? Epidemiologist, yeah, yeah. So she has some backgrounds in there. She knows how these things kind of work out. But let's go over real quick how your immune system kind of responds to an infection. Okay. Um, So typically, when you get some kind of viral infection or bacterial, mostly viral, you'll get two response, right? You have your innate response, which means that, and the reason I'm going over this because it's gonna go over how the vaccine works as well. You get your white blood cells that'll come in and get rid of some of these, viral infections. However, if the viral infection is significant, your immune system, which is the innate, the first response is the innate, the white blood cells, they get overwhelmed, and they get helped out though by your what's the other one called, the acquired, right? The acquired immunity, which means that your body basically kind of studies the virus, and then it basically get rid of it by bringing in T cells and all the other white blood cells that'll come in later. But um, the second response is basically takes a while because your body has to get to know, okay, this is the virus that we're dealing with. This is how we're gonna get rid of it. But it takes a long time. It takes like 5 to 7 days, and that's why sometimes or most of the time when you get infected, you get a viral infection. It takes 7 days to get rid of it, right? Because your body basically by then you're gonna be able to get rid of it, but it takes a couple days. Okay, and this is when your system is basically overloaded with a lot of viral infection. Okay, so I'll go over that real quick because the vaccine kind of plays into that. And it's always good to have this kind of knowledge because you'll be able to explain this later with your coworker, or somebody's kind of say, hey, you know what, I don't really want to take the vaccine because it doesn't work, whatever. Everybody has their own little opinions, but it is what it is. When you study, when you go to nursing school, they teach you this kind of stuff. They teach you how meds work, and they teach you how vaccines work. Okay, so the other thing you can do if you do get sick is that there's certain things you can take. Obviously, right? Eating healthy food is really important when you're sick, right? But the most important vitamins and nutrients you can take is zinc and also vitamin D, because that really is working towards improving and strengthening your immunity. Okay, so don't forget that. A lot of times when doctors are coming in here and we have an infection, they will prescribe like zinc or vitamin D. Okay, a lot of your patients, I know you guys are not passing meds, but every single one of your patient, like 99.9% of them, has either zinc or vitamin D. That's kind of like it's a supplement that the doctor is like primarily putting it in there. Studies are out there that are pretty significant that because these residents don't go outside and get their vitamin D, they need supplemental stuff, right? Like nutrients. And so these supplements like vitamin D helps improve immunity. Okay. So those are two things that you can improve your immunity by taking zinc and vitamin D. And there's a couple of ways to take zinc, obviously, and vitamin D. Vitamin D you get from the sun, or you can get supplemental vitamin D. Inflammatory response. So when you get sick, a lot of times these symptoms is because you have a response from your body, right? It's an inflammatory response. When you injure yourself, you get the swelling and you get redness. All these is inflammatory response. Okay, same thing when you have like a viral infection, respiratory rise, right? You might have coughing that's on there. You might have mucus that's on there, right? And that's really your body's way of saying, hey, there's something there. You got to get rid of it by making all this mucus and trying to spit it out. Okay, so inflammatory response, you'll have symptoms of pain. You might have redness, swelling, and then you might have some heat. That's warmth in the tissue or wherever the tissue is affected. Sometimes you have fever and stuff like that. You're gonna encounter. Okay. Um, Also, let's go over some of the things in terms of what is antibiotics and can you use an antiviral uh, when you have some form of infection. Um, does antibiotics work with antiviral with does antibiotics work with when you have a viral infection? Um, do you think it will work when you if you have a viral? Let's just say you have influenza, right? And then you go over and you hear this all the time, right? Like I'm sick, I have the flu, I gotta go get some antibiotics. And a lot of times the doctor, if you really push it, like I noticed this too, like family members will come in, my daughter's sick, she's got it's a viral infection, but I need to give her some antibiotics. And if the doctor tries to explain something or the NP or whatever, they're gonna just push back. I was like, no, my daughter really needs these antibiotics. But instead of explaining sometimes, right, to the family members or to the patient that, hey, you know what, this is a viral infection, and this antibiotics doesn't really work, you know, you need antiviral. In any case, it sometimes it plays into the psyche of the patient, right? Okay, so you believe that it's gonna work. You need this antibiotics to make you feel better. They give you antibiotics, and for the most part, it will work because it's got that placebo effect, or it just works into your psyche, But for the most part, if you're dealing with a viral infection, you should take antiviral and not antibiotics. Okay, and sometimes people kind of misuse those two things, um, and it's because these bacterial infection they have a cell wall, okay, and antiviral has to get into the basically infected tissue. If you have a cell wall there, it's not gonna get through, okay. So you need antibiotics to peel off the cell wall, and it'll work. In any case, you cannot use or you should avoid using antibiotics for a viral infection. And this is one of the main reasons why we have superbugs and these significant infection that's related to uh, um, um, uh, infections that can't be treated with antibiotics because we overuse our antibiotics. Okay, so that's the number one reason why we provide teaching to family or patient that, hey, you have viral infection, you should probably just rest up, increase your fluids, and manage your symptoms like fever and cough with over the counter. Um, yeah, there you go. Right. Yeah, if you have the colds, really, you just need to rest up. Influenza is a little different. There is some antiviral you can take if you take it 48 hours before, after your first onset of symptoms. Okay, so Tamiflu and stuff like that, it'll work out if you take it early enough. Okay, so that's the most significant part in terms of antibiotics and antiviral. Um, what is the primary treatment for having a cold or whatnot? We always wanna rest your body. Your body's compromised. It's pretty tired. It's going through a lot of when you have a cold, the fever, your body has to work really hard to try to cool it off. So you're sweating, and you likely got sick because you were working too hard, right? Maybe you didn't get enough sleep. Maybe you worked 16 hours, and maybe you've been doing that for 2 weeks now. Now immunity is compromised. You got sick. You got the cold, right? So it's really recommended that you rest up, increase your fluids when you have the cold. Okay, and the vaccines. The vaccine. Let's talk about the vaccine real quick. Is this one the vaccine, the traditional vaccine for influenza, that one that we're kind of used to, that we've been using for a long time, that involves the use of either a weakened attenuated type of virus or some parts of the virus, right? And so that's kind of what we're used to when it comes to the yearly vaccine for the flu, right? There's an actual virus in there, okay? And so the mRNA, though, the one that we use for COVID vaccine, that has to deal with the messenger. There's actually a protein in there that goes into your cell, right? They inject it on your tissue, it goes into your cell, and then it tells your cell, hey, start making these spikes, parts of the virus, right? So the cell that's affected by the vaccine is going to start spitting out these parts of these viruses, the spikes, and then your body basically creates immunity, right? It creates this T cell starts killing all these spikes that your cell basically just generated. That it doesn't have the ability to make you sick because it's not a full virus. It's just the spikes. But what it does is that it increases your immunity. Okay, it tells your system, hey, this is what the virus that you're going to be dealing with in 6 months from now. So when you deal with the real virus, your immunity is gonna know. So it takes, same thing with when you initially got sick, it takes a while, like 7 days for you to get better. Same thing here with the vaccine. Your body starts to generate these B cells, right? And it takes a couple days. But when you do run into that virus 6 months or 1 year later, it's gonna respond right away. Okay, so that way you don't get sick. Okay, now does it work all the time? No, So these vaccines, when you take them, just know that when they're making the vaccines, they take, there could be 20, 30, 40, 50 different types of viruses that they're dealing with. They're gonna take 3 or 4 of them, and they're gonna say this is gonna be the most dominant, and they put that in a vaccine, and then you get injected with that vaccine. A lot of times they get it right, and there's times when they don't. So, for example, if they pick the wrong vaccine this year, and then the one that they didn't pick is becomes the most dominant, it's gonna trump over the ones that are not dominant, right? So you're gonna get sick, and all these people are gonna get sick with the most dominant viruses. So there's gonna be less of those other ones, and it's not gonna infect too many people, because everyone else is infected with the most dominant, right? So it's like a guess, but at the same time, a lot of times they do get it right, because they already know what's most dominant the year before that. Okay, so that's how vaccines work. Um, it just kind of helps to kind of know some of this basic stuff. When you're going out there, you're dealing with healthcare and you're dealing with sickness. I got My whole family got the flu. And my son, my daughter, my wife, and I was thinking about I was gonna get it too. I didn't end up getting it. I was the only one that's vaccinated in my household, so I was able to take care of them. I did have knowledge on how to like test them with the rapid test, so I got them tested and got them treated, pretty early. But um, the I think what the takeaway is that even with me with all this knowledge, I didn't want to give my kids the vaccine for whatever reason. This year I was like, no, you guys are not taking it, because I felt like this year, like I have given them so many vaccines, like I just felt bad, like their little bodies, and just keep injecting vaccines in there. But even with all of that stuff that I kind of know with vaccines, you're just like, I should have known, I should have just gave them the vaccine. I should have just taken the CVS and got the vaccine. But I didn't. And so next year I will. And but it's just because of COVID that has been happening, and all these vaccine, like I said, with school, all these stuff that they needed. I felt like every month there was a vaccine that they were taking. And so this year, yeah, I just like. But anyways, they got sick, and it's probably my fault, but. But the kids are like, they breathe like bacteria and viruses all the time. Like even if they get the vaccine, they're probably gonna get sick. So yeah, yeah, absolutely, yeah, we have immunity. Okay, so and so the way to really fight off some of these infection, guys, is to really take care of yourself, get some good rest, eat healthy. But if you take a look at some of the most the 1918 flu pandemic, because if you ever read that story, if you ever heard of that story, the biggest pandemic before COVID, right? That killed off over 50 million, 100 million people all over the world. They had that influenza, compared to today's influenza, is 100 times stronger and more deadlier. Okay, that's how significant it was. And they found out because somebody who died from Alaska, they basically exhumed them up and found the virus and studied the virus, and saw how extensive and how aggressive that virus really was. It's not 100 years later, 1918, almost 100 years later, which is 2020, right? Which was and it's exactly on March 2018 is usually when like pandemics and viruses comes out. 100 years later, COVID-19 came out, right? But in between time, there's pandemics. There's smaller pandemics here and there. There's the all these infections that happened in the swine flu that came up, yeah, but nothing like the 1918 influenza. And the stuff that we're doing now, guess what? Like the masking and the vaccination and the and spreading apart 6 feet, they were doing it back then. And what's significant is that if social distancing was actually the number one way to decrease the amount of infection. So they found out cities that had parades before the pandemic hit, and they knew the pandemic was coming. And this was like kind of like rampaging throughout the whole nation. People were dying, and there's certain cities that did like these parades and stuff. They had a lot of death, and then people that took actions and started social distancing and didn't have the parades had less people that were dying. So there's all these studies that were coming out that did come out, and when COVID-19 came out, they actually implemented it based on that 1918 pandemic. And so there's still to this point, if we go back and we have another pandemic, closing down and social distancing is going to be the number one way to kind of eradicate or kind of slow down the infection. You're not really going to remove it, but you're going to slow it down. If you really think about it, the number one, if you have if you're infected, you have one cell, right? You have millions of cells. If it gets infected, it starts generating all these viruses. Okay, the more it generates, the more you pick up in your body, the more symptoms you have, the more sicker you are. Okay, now if you're coughing and sneezing, it goes into the air. Think about it. The more you have in your system, the more sick you are, right? But if you social distance, it's just really common sense shit, right? Oh, excuse me, it's common sense stuff, right? And but I was able to do that, mitigate infection control in our what do you call it? Over here in the dementia unit, So when we first started when I first started doing infection control here, remember I was the infection control nurse, and we were one of the few, one out of hundreds of skilled nursing that didn't have infection with our resident until after the pandemic, right? But I always that was in my mind the whole time. I'm like, if it's 6 feet, if you're gonna get infected within 6 feet from somebody who's sick, why not spread out a little bit? And then if that's the case, why not decrease the amount of viral load that's in the building, which is opening up the room, right? And so that's always been in my head during the pandemic, is that you kind of increase circulation, you'll have less likely infection to spread amongst other people. And that's kind of like what I implemented over here. That's what we did here. We opened some doors and windows, and so, but these are, if you believe in it and if you just think common sense, it does work. It does work. But sometimes we get pushed into the brink where people say, "Oh yeah, I don't believe in that, this and that." But it is what it is, and study shows that it does work, and these viruses are pretty deadly, in fact, so there's books and books that are written on the 1918 flu, and some people argue, it's like, no, that was a long time ago. We don't have treatment, we don't have vaccine, we don't have this and that and that. But if you take that exact virus, and they have it in the lab because they've grown it and they studied it, it's amazing how it replicated. It killed off people that are younger, right? 18 to like 40. The younger people that was affected and was dying. And there's cases where there was a village in Alaska. There was 80 Eskimos or something like that was on there, and he killed off 70 of them. Okay, and so imagine 50 million people back then is a lot of people. There's some cities in New York where some kids lost both parents or one parent, but I think America lost over 800,000 or 600,000 people from the pandemic alone, just U.S. in 1918. But I love reading that book. I read it once. I read a new one again recently, and I thought I would share it with you guys. But I read it a long time ago when I was going to school of nursing, and I read another one that compared it into COVID-19. So if you guys have a chance, go pick up a book that deals with the 1918 influenza. It'll blow your mind. I drive a lot, so I buy it on the books here, audio. So it's just easier for me because I'm driving and I can listen to it. So, anyways, any questions, guys? Do we do the test? Do we pick up this? Yeah. Okay. I will not have. Yeah, you're gonna have symptoms, guys. You're gonna have the inflammatory response. You're gonna have. That's why you're having symptoms, because inflammation is kicking in, and then symptoms of inflammation: redness, pain, swelling. What is the primary methods of treatment for common cold? Rest, increased fluids. Um, Getting vaccinated will prevent me from getting sick. That's false. Just because you got vaccinated doesn't mean you're not gonna get sick. And then the new mRNA vaccine contains live viruses. This one is false. Okay, this one has proteins and stuff. There's no viruses in there. Okay. All right. Any questions?
Yeah, you talked about that for the first, the second and the third. I missed them.
Number two is false.
I will not. It says I will not have symptoms.
Oh, you will not have symptoms.
So
I will not have.
technically it's a false, right?
You are gonna have symptoms. Yes, I'm sorry. I wasn't reading it. Yeah.
But then what's the for number 3?
Number 2 is false.
Number 3 is redness, swelling.
Mucus, coughing, fever.
Yeah.
Number 2
Pain.
is false.
Okay, guys. Any questions about anything? Okay.
No, thank you.
All right. Perfect. Thank you.